All right, so we're continuing our discussion of the bones of the face. Let's talk about what are known as the nasal conchae. So within your nasal cavity, you have three sets of bones that curl into the nasal cavity. You can see them here. So there's the superior up here, middle down here, and the inferior down here. And you can see that these bones just sort of create a surface area within the nasal cavity. And the nasal conchae, as they curl in and take up space within the nasal cavity, they're lined with mucosal epithelial tissue. So that is warm and wet and highly vascular tissue, meaning that there's a lot of capillaries in that epithelial tissue. So your blood is very close to the surface on the epithelial tissue that is on the nasal conchae within your nasal cavity. So that tissue is warm and it's moist. And the purpose of it is that when you inhale through your nose, you are bringing the air in and it's being pulled through the nasal conchae over that warm, wet tissue in there, and you're conditioning the air that you're inspiring for the lungs. You're getting the air ready for the lung to treat your lungs as gently as possible. So the purpose of the nasal conchae, superior, middle, and inferior, is that they warm and moisten the air as you're breathing the air in. That conditions the air for the lungs to make respiration at the level of the lungs as effective as possible. So usually anytime you're looking at a skull, you're going to see the inferior nasal conchae curling from the sides of the nasal cavity into curling medially from the sides of the nasal cavity. So if you were like, here's this image here of this skull, you always see these two little bones right there. That's the inferior nasal conchae. Here we have a coronal slice of a cadaver head. So you can see how little space there actually is within the nasal cavity because the inferior, the middle, and the superior nasal conchae take up so much space there. So whereas the inferior nasal conchae curls off of the medial edges of the maxilla, the superior and medial are part of the ethmoid bone, which we're going to cover here in a minute. But before we do that, let's talk about the nasal septum. So by now, I'm sure you've noticed you have a right and a left nostril. And between those two nostrils is the nasal septum. That is the dividing line, the dividing plate between your right and left nasal cavities. Looking up here at this image, you can see this blue portion here of the nasal septum is cartilage. And so that is why the most anterior part of your nose, that's why it's bendy, right? You can move it back and forth. You can sort of squish it down a little bit. Because the anterior most part of your nasal septum is cartilage. Now, if we move back into the nasal cavity a little bit more, you see this triangle here of bone. This triangle of bone is known as the vomer. The vomer comprises the inferior, posterior portion of the nasal septum. So if you look at this skull right here, you can see highlighted in purple this piece of bone that is deep within his nasal cavity. That is the vomer. So the anteriormost section of the nasal septum is cartilage. That's this portion right here. The inferior posterior portion of the nasal septum is the vomer, which is that piece of bone that is right here. And there is a superior portion of the nasal septum that is also bone, and that is part of the ethmoid bone called the perpendicular plate. And once again, we're going to get to the ethmoid here in a second. The next bone we're going to talk about is the zygomatic bone. The zygomatic bone, this is your cheekbone. So looking at this purple one right here, you can see that the zygomatic bone articulates medially. So in the middle, it is connected to the maxilla. You can see that superiorly, it is attached to the frontal bone. And you can see that posteriorly, it attaches to this orange bone here, which is called the temporal bone. And this little orange branch here of the temporal bone is called the zygomatic process of the temporal bone. So the zygomatic bone articulates with the maxilla at what is known as the maxillary process of the zygomatic bone. That is just this part here that articulates with the maxilla. It articulates with the frontal bone at what is known as the frontal process of the zygomatic bone. And it articulates with the temporal bone at what is known as the temporal process of the zygomatic bone. And the temporal process of the zygomatic bone articulates with the zygomatic process of the temporal bone. So notice how the language that we're using works there. So as speech therapists, we do a lot of work with children that have craniofacial abnormalities. So these are anatomical abnormalities of the bones of the face or mandible. And obviously, if you have abnormalities of the bones of the face and mandible, that's going to affect your ability to talk, speech, and it's probably going to affect your ability to chew and swallow. And these are three things that SLPs are responsible for. So here's a video showing the surgical procedure in which they go in and they dislocate the entire maxilla and zygomatic bones of a child, put her in a halo, and they're slowly ratcheting these bones of the face forward a little bit each week to try to get her facial anatomy within the realm of normal.
Yes, I will.
Let me fill your heart with joy and laughter, togetherness, well, it's all I'm after. Whenever you need me, I'll be there. I'll be there to protect you.
Be there with a love that's strong. I'll be your strength. I'll keep holding. yes I will.
If you should ever find someone new, I know he better be good to you.
You can set it free. It breaks. Ooh, I've got what it takes. Learn how to fly a plane. I'm gonna make it to heaven. Light
You are an angel, girl, I know it's true. Sent from heaven to do the things you do for me. You understand me like nobody can, making me wanna be a better man. Angel.
And so here's the zygomatic bone in isolation. You can see it pulled out of this image right here, giving you a good idea of the frontal, the maxillary, and the temporal processes of the zygomatic bone. So that's the bones of the face. Now let's move into skull bones. Starting with the bone that we've already mentioned a couple times, and that is the ethmoid. Let's start with this image so that you guys have a general understanding of where the ethmoid is. So you can see here in this first image, we have pulled the maxilla off of the skull, and we've revealed this little yellow thing right here. That little yellow bone is the ethmoid. As we've already mentioned, you can see that this ethmoid has a piece of bone that projects inferiorly. That is known as the perpendicular plate. And so in this image right here, we're looking at the ethmoid coronally. But if you turn it sideways, you would see that as that bone projects, you're looking at it this way. But if we turn it sideways, you see that it is the perpendicular plate of the ethmoid that forms the superior bony portion of the nasal septum. And if you check out and see these big lateral processes that the ethmoid has on either side of the perpendicular plate, you can see that these lateral processes have the middle and superior nasal conchae. So here's another image down here showing you the perpendicular plate, and it has a better representation of the middle and the superior nasal conchae that are part of the lateral processes of the ethmoid. So for the ethmoid, know its general location, which is behind the maxilla. Know that the perpendicular plate of the ethmoid makes up the superior bony portion of the nasal septum, and know that the lateral processes of the ethmoid have the medial and superior nasal conchaes. All right, so that's the ethmoid. So let's talk now about the sphenoid. The sphenoid bone is the most difficult bone to visualize that I talk about in this section, and that's largely because it's like a bone. It's like there was a lot of space in between a bunch of other bones, and the sphenoid just fills all these random spaces. So let's start with where it is. So starting with the image we just left off. So here's the skull with the ethmoid in place. So there's our yellow ethmoid with the perpendicular plate. You pull off the ethmoid, and you're going to see behind the ethmoid, which is represented in red in this image, this bone. This has a corpus in the middle, which is the body, and it has greater and lesser wings. And this is the sphenoid bone. So looking at this image right here, you can see the corpus of the sphenoid, and that is the part that the ethmoid is usually attached to. You can see superiorly the lesser wings, and these are just the small looking wings. And you can see the greater wings, which are here and here. And the greater wings form a good bit of the orbital cavity, meaning your eye socket. So if you look at the skull right here, you can see that red portion in his eye sockets. That is the greater wing of the sphenoid. And projecting inferiorly, you can see that the sphenoid has these two little guys right here. It looks like he has feet. Those are the pterygoid processes. So if we took the skull that you're looking at like this, in this image right here, and we tilted it up, so there's the foramen magnum, that's the hole through which your spinal cord passes through. We see that hole right here. So you see that red sphenoid bone from this angle. So you're looking up at the sphenoid now. And then you can see that it articulates laterally with the temporal bones, which are here and here. You can see that it articulates posteriorly with what is known as the occipital bone, and that's the bone that has the foramen magnum, and we're going to get to these bones, but that's this one right here. And you can see that it articulates anteriorly with the frontal bone. And that's the sphenoid bone. Structures to know for the sphenoid: know the corpus, right here. Know the lesser or small wings, and know the greater or great wings of the sphenoid, and know what the pterygoid processes are. So now let's move into a more simple bone, and that is the frontal bone. This is the bone that is your forehead. The frontal bone forms the superior portion of your orbital cavities, meaning your eye sockets. It's your forehead, and it's the anterior part of your cranium, which is that part of your skull that houses your brain. And you can see that it articulates inferiorly with the zygomatic bones, here and here. It articulates inferiorly with the maxillary bones, here and here, and the nasal bones, here and here. It articulates inferiorly with the sphenoid bone, so it's touching the sphenoid back in there. And the frontal bone articulates posteriorly with what are known as the parietal bones. And you have a right and a left parietal bone. So this is a paired bone that is that forms the middle portion of the cranium. So the parietal bone forms the middle portion of the cranium, which is the middle portion of the cavity where your brain is located. And posterior to the parietal bones, you have the occipital bone, which we've already identified as having the foramen magnum, which is the hole through which your spinal cord exits the skull. The occipital bone overlays the occipital portion of the brain, just like the parietal bones overlie the parietal lobes of the brain, and just like the frontal bone overlies the frontal lobes of the brain. And we're going to get to those portions, we're going to get to the brain at the end of this class. But just so you know now, occipital bone covers the occipital lobe. Parietal bone, parietal lobe, frontal bone, frontal lobe. And the occipital bone, as you can see, articulates with the parietal bones. The occipital bone articulates with the temporal bone, which we're going to get to next. And you can't see it very well, but the temporal bone also articulates with the sphenoid. The last bone of the skull we're going to talk about is the temporal bone, and it is this orange bone right here on this model. The temporal bone has 4 different parts that you need to know. You see this fan-shaped part of the temporal bone, this wide, flat, fan-shaped part. We refer to that as the squamous portion of the temporal bone. And much of the squamous portion articulates with the parietal bone. The temporal bone also has, you can't really tell in this one, but if I put my pen right here, that's his ear canal. So that's this thing. So if I were to really drive my pen in through my eardrum, I would be pushing it into this hole, which is the ear canal. That part of the temporal bone is referred to as the tympanic portion. So the tympanic portion of the temporal bone includes the walls, the bony walls of the ear canal, which is known as the external auditory meatus. And we're going to get to that also towards the end of class. Now, if you take your finger and you put it behind your ear and you feel that bump right there, what you're feeling is this portion of the temporal bone, and that is known as the mastoid process, or the mastoid portion of the temporal bone. So squamous, tympanic, mastoid. And there's another important feature of the temporal bone that you can't really see, but if I take off my skull case, deep within the bone, within the temporal bone, there is what is known as the petrous portion. So within that bone, you have structures of the inner ear, which is your cochlea and your semicircular canals. These are the parts of your inner ear that are responsible for allowing you to hear and allowing you to balance. And we're going to cover the inner ear in about a month. And also, the temporal bone has the zygomatic process that's reaching out towards the zygomatic bone. And that zygomatic bone, recall, has a piece that's reaching back towards the temporal bone. And we refer to that as the temporal process of the zygomatic bone. Okay, moving on to dentition. So obviously knowing about the teeth is a pretty important part of being a speech language pathologist, because you have to know what is normal for dentition. You have to be able to look into the mouth of a child or an adult and know how what you're seeing is going to affect their speech and their ability to chew and swallow. So you have two sets of teeth. You have your mandibular teeth, and that is the teeth that is set in your mandible. And you have your maxillary teeth, and those are your teeth that are set in your maxilla. If you looked at the tooth itself, we break it down into the crown, the neck, and the root. And the crown is that part that you see that is white with enamel. The root is that part that we're all familiar with that reaches up into our skull, into the dental alveoli to secure the tooth there. And that point of intersection between the crown and the root, which is showing here, is referred to as the neck of the tooth. Baby teeth are referred to as the deciduous teeth, and a child has most of them by the time he's 2.5 years old, and then around the age of 6, those deciduous teeth start getting replaced with your permanent teeth, your adult teeth. You have 20 deciduous teeth, you have 32 permanent teeth, and when we look at our teeth, we tend to divide them into incisors, cuspids, also known as the canines, bicuspids, and molars. And the different teeth have very different functions. Your incisors are these most anterior and medial teeth. And you have 4 on the top, 4 on the bottom. These are your wide blade-shaped teeth. And the incisors are important for cutting into your food. So if I handed you an apple and I said, here, take a bite of this apple, you would move the apple towards the direct front of your mouth, like that, where you're going to use your incisors to cut into that apple. Your canines or your cuspids and your bicuspids, which are like between a molar and a canine, sort of a hybrid tooth right there. These aren't for cutting. These teeth are more for gripping and tearing. So for instance, if I gave you an apple and I said, here, take a bite of the apple, you're probably not going to come at the apple like this, right? Probably not going to. But if I gave you like a raw steak and I said, here, take a bite out of this, you're probably not going to come at the steak with your teeth like this. You're going to come at it sideways, and you're really going to rip a piece of meat off of that steak. And the molars are there for mastication, for chewing your food. So your molars are the grinding teeth. So the incisors cut, the cuspids and the bicuspids are tearing, and your molars are your teeth that are responsible for grinding. That lateral surface of your dental arches, so the lateral surfaces of your teeth, here and here, top and bottom, that is the surface of your teeth that is against your cheeks. And that space between your dental arches and your cheeks, right there, that is referred to as your buccal cavities. And if that's the buccal cavity, then that is why we refer to this surface of the tooth, the outside surface of your dental arches, as the buccal surface. That part, that portion of your teeth, that surface of your teeth that comes into contact with your tongue, so on the inside of your dental arch, that's the lingual surface of your teeth. And the occlusal surface of the teeth of your dental arches are those parts of your teeth that come together. So if I stuck my finger in and I bit it, I'm experiencing the occlusal surfaces of both my upper and lower dental arch crushing my finger. And here's an image that gives you the general age of eruption, normal age of eruption for teeth, for baby teeth. And this is something that you need to generally know, although I'm not going to ask you about it and you're not going to be tested on it. But looking at a little baby like this, knowing that those little two vampire teeth right there on the bottom, those are the first ones that pop out. And then come the two little teeth on the top. And the teeth sort of work their way in from front to back, getting those deciduous molars last. And then they're replaced by the adult teeth in much of the same way. The permanent teeth come in, starting at the front, and then working their way back.